3. Clinical manifestations of MTHFR deficiency. The symptoms of MTHFR deficiency can vary depending on the age of onset and the level of enzyme activity. For infants and children who develop symptoms early, the symptoms are typically severe. These children may show signs of weakness, weak crying, difficulty sucking, and poor feeding shortly after birth. As the condition progresses, they may experience seizures, altered consciousness, and even respiratory suppression. These children often also have microcephaly, developmental delays, and even progressive white matter damage in the brain. High homocysteine levels can also damage blood vessels, making babies more prone to thrombosis and cardiovascular complications. Even worse, stressors such as infections, malnutrition, or anesthesia can suddenly worsen the symptoms. For teenagers and adults, the symptoms may be more subtle and varied. Common signs include movement disorders and gait abnormalities. Some patients may experience leg stiffness, difficulty walking, or foot inversion, which can even progress to spastic paraplegia. Cognitive impairment is also a significant issue, with about 74% of patients showing memory loss, inattention, and even intellectual decline. This is often associated with white matter lesions in the brain and low methionine levels. In addition, about 50% of patients may experience seizures, and some may suffer from recurrent encephalopathy and altered consciousness. Psychiatric symptoms like hallucinations, mood swings, or depression are also possible and tend to appear before neurological symptoms, making them easily misdiagnosed as primary psychiatric disorders. Additionally, due to high homocysteine levels, some patients may develop thrombosis, leading to conditions like venous thromboembolism or stroke. Given the wide range of symptoms, many patients may be misdiagnosed for years before receiving the correct diagnosis. Early screening and diagnosis are crucial, especially when there are unexplained psychiatric or neurological symptoms. The good news is that supplementing with betaine, folate, vitamin B6, and B12 can improve symptoms in some patients, particularly when it comes to gait, cognition, and psychiatric symptoms. So, early diagnosis and treatment are key.